Did you know that 1 in 10 women suffers from PCOS or polycystic ovarian syndrome? Despite how common it is very misunderstood, and it can actually cause so many issues and challenges, and we don't realize we have it until we cross that bridge. If you'd like to learn what PCOS is, how it's diagnosed, how it can be managed, stick around and we'll go through all of that in this video. So what exactly is PCOS? PCOS stands for polycystic ovarian syndrome, and it affects people that have ovaries. So women typically will have symptoms, but it's an array of symptoms, so it's very hard to distinguish. And with this syndrome, all of these symptoms together leads to irregular hormones. The balance of the hormones is not correct and it causes infertility. Typically what you tend to see is high androgens. These are the male hormones in our bodies. And when we have this high level of androgens, it impacts all the rest of our hormones. The biggest issue that we face with PCOS is that these androgens are actually going to stop ovulation or make it irregular. And when we have irregular ovulation, it is very difficult to conceive or get pregnant. So this can be a really big issue for women that are dealing with PCOS. Symptoms can vary widely with PCOS. No two women are really going to be the same, but usually symptoms that you would see in the syndrome include excessive hair in very unusual places, right? You could have issues with your skin like acne, thinning of hair on your scalp, weight gain, or not being able to lose weight, and then the irregular periods. So irregular periods we see women having all the time, and it's kind of one of those things where it's like, oh, that's just normal. But if it's paired with some of these other symptoms in the syndrome, it actually can be really difficult for a lot of women. Aside from those fertility challenges that I mentioned before, it also can put you at risk for long-term health conditions. So women with PCOS are more at risk for diabetes, for heart disease, even for depression. So it's a really important thing to understand. And if you're not sure if you have PCOS, we're gonna get into how it can be diagnosed. Now let's talk about how is it diagnosed, right? There isn't a single test to rule out PCOS. Really, it needs to be a comprehensive, thorough examination, and it's going to involve some time. So typically you would go in having symptoms and there would be blood tests run. These blood tests would make sure that you're not at risk for any chronic conditions. Also checking your hormones to see, do you have an imbalance? If you have those high androgens, then that could be a clue, right? That maybe you are dealing with PCOS. The next thing that's really helpful is getting an ultrasound. So having an ultrasound of your pelvis is definitely going to look anatomically to see, is there anything that could be abnormal? And typically in PCOS, not all the time, but sometimes you will find that you have a lot of cysts, and these cysts or follicles are going to be in the ovaries. So when your medical provider is trying to make that official diagnosis, they are going to use criteria. It's the Rotterdam criteria, where you have to have 2 out of 3 symptoms. So irregular periods, having those high androgen levels, and then having cysts on the ovaries. If you have any 2 out of 3, then you do have PCOS. So although PCOS can impact fertility, it does not mean that it's impossible to get pregnant. With the right management of PCOS and all those symptoms, it is definitely possible for you to still have a baby. There are lifestyle changes that can be made, dietary changes, even making sure that you're managing stress levels. There's even medications that can help to manage PCOS. So if you are diagnosed with PCOS, it does not mean that it's over for you to be able to have a family if that's what you desire. Definitely, I want you to remember that it's important to stay positive once you have a diagnosis, because PCOS, it's a journey. It is something that you will be dealing with long term. However, if you have the right tools, information, and support, you can manage it effectively. If this video has helped answer some of your questions about what PCOS is and how it can be diagnosed, please give it a thumbs up and subscribe to the channel for more tips on how to manage PCOS. And if you have any questions or if you've experienced PCOS personally, leave a comment below. I'd love to hear your journey. I'll see you guys in the next one.